This is Average Joe PT. For Scully and I, we're here to reduce your pain, reduce anxiety, and then hopefully make you feel a little bit better. But today, we're going to talk a little bit about the shoulder and some of the things that I have not talked about before, specifically in quite a while. So stay tuned. Now, Scully and I, we've been doing this for probably about, give or take a year or so. Haven't we, Scully?
That's right, we have.
That's right, and we've talked about the shoulder before, but we're going to talk a little bit more specifically about rotator cuff injuries that affect some of the muscles that run right up into here. This little spot right here that gives people a lot of problems and gives them pain and headaches. Now this muscle that I'm going to show right up here, that's right, that's your levator scapula muscle, and that gives a lot of pain, refers all the way up into the neck. I'm going to show you a little pic right there. Okay, and so that'll give you an idea of what exactly we're talking about. Now that muscle group itself really helps to rotate your shoulder. Now that's attached to your shoulder blade, and if you've seen previous content of mine, so you can go ahead and take a link up there and you'll see what I'm talking about, all the different shoulder videos that I've gone over in different treatment techniques. So this one right here, the shoulder blade, the collarbone, and the humerus bone or arm bone are all one piece when we talk about your arm going over your head. And so specifically that muscle group, the levator scapula, can give you a lot of pain across the back of the head, into the neck, and give you headaches, as well as way down low into your shoulder blade where it sits on the back of your ribs. That's very important. Now, one of the treatment techniques I always tell everybody, isn't that right, Scully?
That's right, we tell everybody this.
Yep. We want to try and put this muscle in a shortened position, because more times than not, the tissue, this muscle group, is over elongated, and that means it's always stretched out. So we don't want to stretch it more, we want to shorten it. So I tell people to do is just go ahead and kind of pull your shoulder blade in and maybe just rest it there. Put some ice on it for a few minutes, 15, 20 minutes, 3-4 times a day. Probably appropriate the first 3 or 4 days if you flared this thing up, maybe in the gym, maybe outside shoveling dirt, anything like that. Maybe if you're sitting incorrectly for hours at a time, kind of slumped forwards, that'll irritate that muscle group. And last thing you want to do is have people pushing on that area, which is essentially they think it's just a knot, and it's not that. Ha ha ha, ain't that right, Scully?
Oh, brother. No.
Right? You want to ice it and shorten that thing and stay away from aggravating movements, overhead movements, poor postural positioning for at least 3 or 4 days until it actually gets better. So that is more than likely causing a lot of your pain in the shoulder area and in your neck, is that levator scapula muscle. And it can have what we call active and passive trigger points to them. When it gets flared up and starts giving you pain all over the place, that's an active trigger point. Right around in that area, right where I was showing you guys earlier. Now, that right there is some good education for free. It's free, people, it's free. So we'd love to have you subscribe down below. I got tons of content on here. Not only shoulders, necks, backs, knees, ankles, positioning techniques, all kinds of treatment things that you can do to help reduce pain in your home. Isn't that right, Scully?
That's right.
Yeah, we got some free stuff. So if you have any questions or comments, kind of leave them below, positive or negative. It's all good here. And hopefully you guys will be part of our family. But until next time, Scully and I always say we want you to look up and keep smiling. See you next time, folks.